My name is Molly Evans. I'm with the Executive Office of Elder Affairs. You very thrilled to have you for the latest webinar in our Caregiver webinar series. Today's webinar, we're very lucky to have Kathleen also from Elder Affairs to talk about the SHINE program, which stands for Serving the Health Insurance Needs of Everyone. And not only are we lucky to have Kathleen today, we're lucky to have her for a two-part series. So today, Kathleen is going to provide an overview of the SHINE program, how program services can assist family caregivers in Massachusetts, and basics about Medicare eligibility costs and penalties. And for our second webinar in the two-part series on Thursday, March 28th, Kathleen will talk about programs that might assist families with Medicare costs. So before I turn it over to Kathleen, just a few housekeeping reminders. The first is that the transcription feature is available at the bottom of your screen if you're joining us live, so you can enable or disable that at any time. The second is that after Kathleen walks through the slides today, we're going to have plenty of time to answer your questions. So feel free to ask questions in the Q&A or the chat feature. And with the Q&A, you can submit your questions anonymously if you would like. Just know that she won't be answering questions as we go along, but we'll have plenty of time at the end to answer your questions. So definitely want to make sure that we have plenty of time to address your questions and your needs as family caregivers. That's what these webinars are all about. And lastly, before you sign off today, and we'll mention this at the end, we hope you will fill out the post-webinar survey. That's how we're able to create webinars and content that's answers your questions, provides you with the information and resources that you need. So with that, I will turn it over to Kathleen and pop back on for the Q&A at the end. Thank you so much for joining.
Well, thank you, Molly. So my name is Kathleen Gouveia. I am from the Executive Office of Elder Affairs. I am the SHINE training coordinator. So I hope that from today's webinar, you are able to gain knowledge on what the SHINE program is, what Medicare is, and then how we relate to caregivers and SHINE. So I have a great case that I'll talk about later about how the SHINE program was able to help caregivers with dealing with Medicare. So the first thing, and I know Molly had said this, but what does SHINE stand for? SHINE stands for Serving the Health Insurance Needs of Everyone, meaning everyone on Medicare. We are a federally funded program by the Administration for Community Living, which is a part of the U.S. Department of Health and Human Services. Another fact to know is that the SHINE program is just one of many throughout the U.S. Every state does have what's known as a SHIP program, a state health insurance program. Ours here in Massachusetts is SHINE, and across the U.S., there are many different names for their programs. Our mission here at SHINE is to provide free, unbiased health insurance information, counseling, and assistance to Massachusetts Medicare beneficiaries of all ages and their caregivers. We also provide screening for public benefits programs. So there are many programs that Medicare beneficiaries may be eligible for. So we want to ensure that we are reviewing programs for beneficiaries to see if we're able to assist with helping with the cost of Medicare. The SHINE program here in Massachusetts is composed of 13 regional offices that cover the entire state. And we also have a regional director at the Greater Boston Chinese Golden Age Center. We have about 80 bilingual counselors as well. Our program is comprised of about 700 certified SHINE counselors. So they go through a 40+ hour training to become certified as a SHINE counselor. About 60% of these SHINE counselors are volunteers. So they are volunteering their time as a counselor. The other Portion of counselors are at like community health centers, council on aging. So they may have one job, but Shine is also included in what they do because, as you know, many of these things go hand in hand with each other. Below is the phone number for Mass Options here at the Executive Office of Elder Affairs, and our email box, our email address here at the state is shine@mass.gov. But at the end of the presentation and as well as in the chat, we will put my email as well. So what can Shine do? So some examples of what Shine can assist with is we can help Medicare beneficiaries or yourself as a caregiver understand the choices that somebody has when they are enrolling into Medicare. We also can review how to enroll. We can conduct plan comparisons because there are many different plans, as many of you may be aware of, whether it's a Medicare Advantage plan or a Medigap plan or a prescription drug plan. There are many plans that we can compare and kind of tailor it to what the beneficiary is looking for coverage and costs. Again, we discuss coverage and costs. So many people are unaware of the cost of Medicare and all of the different parts. So I'll talk a little bit more in the presentation about the cost for Medicare. Also paying for Medicare prescription drug cost. There are some additional programs that do assist with this, and I will be discussing this more at our March webinar. Also, troubleshooting billing issues, submitting appeals, working with the Senior Medicare Patrol, who really assists with fraud and abuse. So making sure that we are referring people to the correct location to really get the help that they need. Open enrollment. So this occurs every year. It's October 15th through December 7th. This is the time where we see a lot of our Medicare beneficiaries here in Massachusetts and really across the US. But here at the Shine program, we see a lot of our consumers because we are reviewing their plans for the following year. And I'll talk a little bit more about that. And then referral to other resources. So sometimes we are the first place that beneficiaries are coming to a senior center or community health center. They're learning about the Shine program, and then they're really coming for other resources that they're looking for, and we're able to refer people to the appropriate place, or as known as Mass Options as well. So what is Medicare? Medicare is the federal health insurance program that helps with the cost of health care, but it is not comprehensive. So there are many things that Medicare does not cover, or Medicare covers, but there is still a cost associated with it for the beneficiary. And it also does not cover the cost of long-term care. There are 3 parts of Medicare. The different parts of Medicare cover specific services. So the first one is Part A, and this is hospital insurance. So anytime that you are admitted into the hospital, many of the things are going to be billed under Part A, except the physician services. So Part B is the medical insurance or outpatient services that a beneficiary may receive. And so anytime somebody is admitted into the hospital as an inpatient and they see physician, it's actually going to be billed under Part B. But for an example, for an outpatient, services could be getting x-rays or labs or physical therapy, OT, things like that. Then we have Part D as in dog, and that is the prescription drug coverage. So this is the prescription drug plan that you would be using to go to your local pharmacy to pick up your outpatient prescription drugs. And over here on the right-hand side is what the Medicare card looks like. It's red, white, and blue. Another one that is not on here, but you may have heard of is Part C, or Medicare Advantage plans. And those are plans that are contracted with CMS or Medicare. And what they do is they basically take your Part A, B, and usually your Part D and comprise it into one plan. So you're only working with one insurance company. So who is eligible for Medicare? Somebody who is age 65 or a U.S. citizen or a lawfully permitted resident for at least 5 years. Medicare is also available for consumers who may have a disability, who are under the age of 65. Also, you know, these beneficiaries would have to have received 24 months of Social Security disability insurance payments, and then they would become automatically eligible for Medicare. Also, somebody who has ESRD or end-stage renal disease or ALS, there are some eligibility factors with that, but they would be eligible for Medicare almost automatically. Most people are eligible for premium-free Part A if they have paid Medicare taxes long enough through their own or their spouse's or ex-spouse's work record. So it's good to check on that, and I'll talk a little bit more about who does the eligibility. Another note here is the increase in age for full Social Security benefits does not affect the eligibility for Medicare at age 65. So where do you enroll in Medicare? So Social Security is the entity that handles enrollments in Parts A and Part B. If you are not already receiving Social Security benefits, you will need to enroll by physically going to the Social Security office or making an appointment over the phone or online at ssa.gov. If you are already receiving benefits from Social Security, so you are somebody who, are under 65 but receiving benefits from Social Security like SSDI, you will get Medicare Part A and Part B automatically when you first become eligible after that 24 months of payments. So then we have the enrollment period. So these are critical to remember because if you miss enrollment periods, it could result in it could result in penalties, but it also could result in a lapse of coverage. So the first opportunity that somebody has to enroll in Medicare Parts A and B is what's known as the initial enrollment period, or IEP. And this is the 7 months surrounding somebody's 65th birthday. Then there is the special enrollment period, or SEP, and just in 2023, there have actually been an increase in some special enrollment periods for Part B, but the one that I'm going to talk about and focus on is for somebody who decides to continue working past age 65. They would actually have a special enrollment period after 8 months, when their employer group health coverage is going to be ending, they actually have an 8-month window to enroll in Medicare to avoid the late enrollment penalty. So that's an important one to know. And then if they miss their initial enrollment period or they miss their special enrollment period, the next opportunity that somebody would have would be the general enrollment period, or GEP. And that time period is actually right now. It's January 1st through March 31st. And so somebody can enroll in Medicare if they're eligible. And their coverage effective date would be the 1st of the following month. Then if you are someone who already has Medicare or you want to make changes to your coverage, there are a couple of opportunities that you may be eligible for. And the first one is the yearly open enrollment period. And that is available to anybody who has Medicare. That is the time frame of October 15th through December 7th. This is when you can review your plans, ensure that you're going to have the most adequate coverage for the following year. And when I say coverage, I mean, is it going to cover all of your medications? Is it going to cover your physicians if you have a Medicare Advantage plan? And what are the costs going to be? Is there a better plan out there for you that might just make more sense? Then we have the Medicare Advantage open enrollment period, and this is currently right now. And this opportunity is every year. It's January 1st through March 31st. And this is if you currently have a Medicare Advantage plan. So you can actually review your plan again, and you could potentially, maybe you're not a fan of the plan you're in, or it's not covering something that you need. You could actually review plans and enroll into a new plan again. Then there are what's known as special enrollment periods, and these are very specific circumstances, and there's timeframes that surround that. But for example, if you're someone that has lost mass health, you would then have a 2-month period to enroll into Medicare. Also, if let's say you move from one county in Massachusetts to the other, or another state, you're going to generally have about a 2-month window to enroll into a new prescription drug plan or Medicare Advantage plan. So you have another opportunity. But Shine counselors, we can review your situation and try to see if there is a special enrollment period that would grant you access to make a change. I just wanted to provide this enrollment period, the IEP. Just a quick snapshot of it, but let's say your birthday is July 15th. Again, you have that 7-month window surrounding that birthday, starting in April and ends in October. Working past age 65, I know I spoke about that a little bit. This is if you are covered by your employer group health plan or a spouse's group health plan as a current employee, and this is not COBRA. You may want to delay enrolling in Part B and enroll in Part A only. The reason B is because you may be still covered under that employer group health plan, and now you're paying for Medicare Part B, and that you're paying your duplicate, making duplicate payments that you don't need to. So the first thing is you want to check with your employee benefits manager to ensure that you need to enroll or not. Also, if you are covered by a high deductible health plan with an HSA or health savings account, you may want to delay enrolling in Part A because you cannot contribute to an HSA at the same time as your Part A coverage will begin. Again, so after your IEP, you would then have a special enrollment period to enroll in Part B while you're covered by your employer group health plan. And this is for up to 8 months after your coverage ends. Of course, if you know that you're going to be ending your employment and you know the end date of your insurance, you want to try to avoid a lapse in coverage. But you do have that 8-month buffer where you could wait to enroll in Medicare. After your IEP, if you do not qualify for a STEP, so you are not working, or you may not qualify under any of the new special enrollment periods in 2023 that came about, you will need to wait until that general enrollment period, which is January through March of each year. You can delay enrollment in a Medicare Part D plan if you have prescription drug coverage that is considered to be good as or better than Medicare, called credible coverage. Examples of that would be like VA coverage or retiree coverage. So that's just another important fact to know. And then you do have a 2-month special enrollment period to enroll in a Part C or Part D plan when your employer group health coverage ends. So you have that 8 months to enroll in Part B, but you only have 2 months to enroll into a Part C or a Part D plan. So penalties. So I'm not going to focus too much on the Part A late enrollment penalty, but for someone who is not eligible for premium free, so they did not pay into their Medicare tax, they would have a monthly premium. It may go up 10% for twice the number of years that you signed up late. We don't see that as often. One that we do sometimes see is the Part B late enrollment penalty and the Part D late enrollment penalty. So the Part B late enrollment penalty, again, if you might have missed your Part A, you might have missed your initial enrollment period. You might have missed your special enrollment period after you left employer group health coverage, and now you're going to enroll during the general enrollment period because you have that opportunity. But if you missed enrolling in Part B when you were eligible and you did not have other coverage through your employer group health plan or something, a surcharge would be added to your monthly B premium for life. The Part B late enrollment penalty is calculated at 10% of the current Part B premium for every 12-month period that you did not enroll or do not have employer coverage through current employment. Then we have the Part D enrollment penalty. So if you do not have Part D coverage, even if you take no prescription drugs, so for example, you're 80 years old now and you did not take any prescription drugs, and now you've been prescribed prescription drugs, and now you're enrolling into a Medicare Part D plan, you're now going to have a penalty for all of the years that you did not have coverage. And so that penalty is calculated at 1% of the national base premium, and that's about $34 right now, for each month that you were not enrolled in a Part D plan or did not have creditable coverage. So what are the costs to Medicare? So in 2024, like I've said before, Part A is generally free for Medicare beneficiaries. Although with Part A, there is a hospital deductible. This is not an annual deductible. This could occur depending on how many times you are actually admitted into the hospital and if you have gone past the benefit period. So you could potentially pay this a couple times a year, depending on how often you are actually admitted into the hospital. So that amount is $1,632. And again, the physician services are charged to your Part B. There's also a Part A hospital coinsurance. So really at day 61 to 90, it's about $408 per day. Then we have the Part A skilled nursing facility coinsurance, or SNF. So for the first 20 days, it's $0. And then after that, it's about $204 per day. And this is again per benefit period. Then we have the Part B standard premium. And this amount for 2024 is $174.70 a month. If you are taking Social Security payments, it's going to come directly out of your Social Security check. If you're not taking Social Security distributions, you will be billed on a quarterly basis. This amount for the amount of months. Also, I just want to note here too, if you are a higher income individual, you may pay more due to IRMA, which is the income related monthly adjustment amount. So it is a surcharge on that. But remember that there are opportunities that you could appeal it. Let's say your situation has changed. So there is the opportunity that you could try to appeal that and go back to the regular standard premium. Then we have the Part B deductible. This is an annual deductible. Example of this is going into the doctor's office in January. You're going to be responsible for the first $240. And then after that, if you have original Medicare, generally Medicare is going to pay about 80% and you're going to be responsible for the remaining 20%. Then we have the Part B coinsurance, and this is 20%. So like I just said, Medicare is 80%, and then you're going to be responsible for the 20% for most of those Part B services after that deductible of $240 has been met. Part D premium, so in 2024, the cost of them have ranged from about 50 cents up to about $155.80. Again, if you are a higher income individual, you would pay more due to IRMA. There are many preventative benefits that are available at no cost. So I just spoke about, 80-20, some of the costs associated with Medicare. So this is generally why some people may look for some additional coverage. So you can purchase additional coverage, and how do beneficiaries do that? So they may look at Medigap plans, or also known as supplement plans. They may look at enrolling themselves into a Medicare Advantage plan or a Part C plan. Also looking for prescription drug coverage, retiree plans if they are eligible for those, and then also VA benefits as well. This is a snapshot of your Medicare choices. So there's two ways of looking at this. On the left-hand side is somebody who has original Medicare. They have their Part A and their Part B. Then they need to decide if they want prescription drug coverage. It's not required, but if you do not take Part D, you will have a late enrollment penalty when you do decide to take your Part D. And then some people may add supplemental medical coverage or Medigap plans. And I'll talk a little bit more about that in the next slide. On the right-hand side, we have the Medicare Advantage plans, HMOs or PPOs. And this, again, takes your Part A and your Part B medical, and usually your Part D prescription benefits, enrolls them into one plan. So the Medicare Advantage plan basically will set some of the rates of what the cost is going to be for you. So it's not going to be an 80-20. It's going to be, here's the copay for your physician services, here's the copay for occupational therapy, and things like that. And then you cannot have a Medicare Advantage plan and a prescription drug plan. Same thing with, you cannot have a Medicare Advantage plan and a Medigap plan. So you kind of have to decide which direction you're going to go in. So Medigap plans here in Massachusetts, we're pretty unique because we do have a waiver. So we have some great opportunities. We have a continuous open enrollment for Medigap plans. So you could go from one Medigap plan to another Medigap plan at any time during the year. Of course, when you enroll, your coverage does start the first of the following month. But there are many other states that you're not able to do that. So Massachusetts does have some great perks to looking at Medicare coverage here. Medigap plans are sold by insurance companies. And the different ones that they have are Supplement 1, Supplement 1A, and Core. All of these insurance companies have to offer those three standard plans. So Supplement 1 is going to be the most expensive, and it is only there for people who are eligible for Medicare prior to January 1st, 2020. But it does basically take that 20% that I was talking about and cover that. So let's say you go to the doctor, Medicare is going to pay 80% and you're responsible for the 20%. Well, that Medigap plan is going to actually pick up that cost. Medigap plans do have a higher monthly premium compared to a Medicare Advantage plan. I do have a slide coming up that has a side-by-side of what they look like, comparing Medigap versus Medicare Advantage. So then there's Supplement 1A. It's the same as Supplement 1, except for the beneficiary is responsible for that Part B deductible, which is $240 in 2024. Then there's Core. It's the least expensive one. So there are some out-of-pocket costs for the beneficiary. And so what those would be the Part A and Part B deductibles. And the plan does cover that Part B coinsurance and hospital copays. There's basic coverage for each product in the same, it's pretty much the same regardless of the company, but some companies may offer some additional benefits like foreign travel with some of their core plans. And the great thing about Medigap plans is you can use any provider who accepts Medicare and there are no referrals needed. One thing that's important is Part D coverage is not included. So you would have to add a prescription drug plan to your Medigap plan. It will be separate, but you do have to enroll separately for that. Then we have Medicare Advantage plans, or Part C. Coverage, again, is provided by insurance companies, many of the same ones that have Medigap plans. They must provide all of the Part A and Part B benefits. Most of them do include Part D coverage. Because you can't have a standalone Part D plan, you would have to look for a Medicare Advantage plan with prescription drug coverage to avoid that Part D late enrollment penalty. Provider networks do apply, whether the plan is like an HMO versus a PPO. You may have copays and coinsurance that are different from original Medicare. There are some additional benefits that may be available, such as limited vision, dental, hearing, fitness. They may give you what's known as like a flex card and load some, additional like over-the-counter money on there where you can purchase things. Plans do have to have an out-of-pocket maximum. So again, your Medicare Advantage plan might have a lower monthly premium, but depending on how you are using the healthcare system, you're not really sure how much you're going to be spending. But there are out-of-pocket maximums that CMS has put forth that a plan cannot go past, but the amount does vary by plan. There are many $0 premium plans that are currently offered by all of the companies. Enrollment periods apply, so you can't just enroll at any time during the year. Depending, you might have to wait for the Medicare open enrollment period in the fall, or you might have a special enrollment period, or you might be in the Medicare Advantage open enrollment period. So these enrollment periods do apply to Medicare Advantage plans as well. And again, I've talked about open enrollment, October 15th through December 7th. It's so important to review your plans annually because you may go to the pharmacy in January and find out that the prescription drug that you have been taking for years is no longer covered under your insurance company. So we want to make sure that we're reviewing everything and ensuring that you have the best plan possible for you for the following year. Again, quick here, Medigap versus Medicare Advantage. I'm trying to be mindful of time, so I'm going to skip over this, but this is a great tool for you able to be a side-by-side comparison of Medigap versus Medicare Advantage. Then we have prescription drug coverage, Medicare Part D. This is for beneficiaries who have Part A and Part B. It does cover the outpatient prescription drugs that you may be prescribed from a doctor. Enrollment periods do apply as well. Initial enrollment period, open enrollment period, or special enrollment periods. Again, you would have a late enrollment penalty if you did not have creditable coverage or enroll when you were eligible for Medicare. Again, reviewing plans annually during the open enrollment period is critical because, again, you may find that one of your prescription drugs isn't covered in the following year. Medicare.gov is a tool that Shine counselors use to review your account. If you have an account, we're able to see if you have things such as extra help. We're able to see your zip code, put in all of your prescription drugs, and really review and try to tailor something or find a plan that is going to work the best for you. Anatomy of a drug plan. So I'm sure you may be familiar or have heard these terms: monthly premiums, annual deductibles, initial coverage, coverage gap, and catastrophic. So monthly premium, so that's the amount that you are paying for that plan on a monthly basis. Then you may have an annual deductible. So the most that a plan could have in 2024 is $545. But not all of your prescription drugs may be affected by the deductible. So it's important to know and really review your plan and see where your drugs are tiered and what the cost is going to be for you. And so Shine counselors are able to really do a deep dive and look at all of that information. Then we have the initial coverage. So copays and coinsurance by tiered. So they tier them by preferred generic, preferred brand, etc. Then there's a certain amount that once you get to that amount, you would then go into the coverage gap. And in the coverage gap is where you would be paying or responsible for about 25% of the coinsurance. Then we have what's known as the catastrophic. And previously, before, beneficiaries were paying about 5% in the catastrophic for the prescription drugs. But now in 2024, the beneficiary is paying $0 in the catastrophic phase. So it really amounts to the amount of money that you, your plan, and Medicare are paying is when you're going to get down to, going from one part of the drug plan to the next. Other considerations, you want to ensure that your prescription drugs are on the plan's formulary. They can change during the year, and they can change annually. You want to ensure that you're looking at restrictions or their quantity limits, prior authorizations, and is there step therapy. Step therapy is when the plan might say, we can't fill this prescription. You're going to need to take certain amount of drugs, certain drugs, before we can then try this really expensive prescription drug. Preferred pharmacy pricing. So we try to look at preferred pharmacies because sometimes they have contracts with the pharmacies to potentially offer lower prices for beneficiaries. So we do try to keep an eye on that. And then all Part D and Medicare Advantage plans that offer insulin on their formulary, they can only offer it at a maximum of $35 each for a month's supply in all of the phases. So the premium, deductible, coverage gap of the Part D benefit. What are some common Medicare missteps? So missing key deadlines when signing up for Medicare Part A and B. Again, it can result in gaps in coverage and penalties as well. Keeping your Part C or Part D plan on autopilot. So again, premiums may increase. Your prescription drugs may no longer be covered, or your physician may no longer take that Medicare Advantage plan that you're in. So trying to be mindful and check your plan every year during open enrollment is critical. Buying the same plan as your spouse or your friend without doing research. So Medicare is a very individual thing. So what works for one person may not work the best for you. Going to out-of-network providers when you have, when you have a Medicare Advantage HMO plan that are non-emergency. So they may not cover it and you're going to be responsible. Delaying Medicare enrollment if you have COBRA or retiree coverage. So if you are offered COBRA, you do still need to be mindful of Medicare enrollment. Not contesting to the income-related adjustment amount or IRMA for the year that you retire, because we know that your income has actually changed, potentially drastically changed. So you could contest that and say, here is what's going on. I'm no longer working, so that's not my income. So be sure to be mindful of that as well. So I want to end here talking about caregivers and Shine. So I can't tell you how many caregivers I've spoken to, our counselors talk to, who are taking care of Medicare beneficiaries. And as we know, there's a lot already that you may be responsible for taking care of someone, being a caregiver. And we know that Medicare can be very complicated. I just went through a lot of information in a short amount of time. and it can still be very confusing. So I just wanted to quote one of our Shine counselors who actually, she was a caregiver for her mother, and she actually ended up becoming a Shine counselor and now works with us. So I just want to quote this here. So as a caregiver, the Shine program helped me to navigate a very challenging time and locate services and supports to help me cope. I was the primary caregiver for my elderly mother who suffered from dementia, when her care became too much for me to manage and also hold down a full-time job, I made the difficult decision to stop working. I soon realized that her expenses far outweighed her income and sought guidance from the Shine counselor at my local COA. The counselor screened my mother for several Mass Health programs and suggested that I apply for the Frail Elder Waiver. This program helped to cover her medical copays and deductible, and also qualified for her to receive extra help, which significantly reduced her medication costs. The counselor also suggested that I apply to become my mother's personal care attendant through the PCA program, which paid for me to work while I was for the work that I was doing, allowed me to keep my mother in her own home, and also covered some periodic respite care for me. I will always be grateful to Shine for educating me on the availability of these programs and for making my caregiver journey a little bit easier. So I just wanted to comment on that as well, is that if you're not sure about Medicare information or some additional programs, which in our next webinar in March, I am going to talk about some of these things like Frail Elder Waiver and some programs that are available to Medicare beneficiaries here in Massachusetts to help cover some of those costs. So here are some additional resources: Social Security, Medicare, pharmacy outreach at the Mass College of Pharmacy and Health Sciences, Prescription Advantage, and Shine. Again, mark your calendar for the next presentation in March that I will address programs that may assist you with Medicare costs. I know Molly's probably going to put the link in the chat, but the next webinar is March 28th. And thank you. And then Molly.
Thank you, Kathleen. That was great. Lots of questions in the chat and the Q&A, so we can dive right in. And as we move along, feel free to continue to add your questions to the chat and the Q&A, or feel free to submit thoughts or feedback, topics you'd like us to cover in the next webinar on March 28th in the post-webinar survey or by email. So we can dive right in. So the first was about eligibility for out-of-state residents. So someone wrote in the chat, I live in Massachusetts, but my 87-year-old mother does not. She lives in New York State. Will today's webinar apply to her too, or only to Massachusetts residents? Great question.
That is a great question. So I'm actually going to put a link in the website, link in the chat. So every state here in the US has a SHIP program. I'm not sure what the one in New York is, but I will put a link directly to how to find that out, and you can contact them directly. Some of the things, I would say majority of the things that I spoke about when it came to original Medicare, Medicare in general are, nationwide. But when it comes to like Medigap plans, Medicare Advantage plans, things like that, there's more Massachusetts specific things. And then in our next webinar in March, those are, some of them are federal, but then some of them are statewide too. So I would strongly urge you to connect with the New York SHIP program as well, because they'll be better able to explain New York specific things.
Great, thanks, Kathleen. There were a lot of questions in the chat about sharing the PowerPoint. I think that is very telling about, there was a lot of great information in the PowerPoint. I will say usually we just post the recording on YouTube, but I think, Kathleen, if you're comfortable with it, considering how much interest there was, perhaps we can send the deck out to those who registered for the webinar. So we will do that. And if you're joining us through the recording on YouTube, after the fact and did not register, you can email us for a copy of the slide. So caregiver@mass.gov. And I see, Kathleen, you put the link in the chat to answer the last question about the sort of other state guidelines.
I just want to comment on one too. So somebody said this webinar was very helpful. I'm 60 and trying to get prepared and educated about Medicare. Thank you. So I just wanted to let you know that things change every year. Costs, different regulations go through. And so I strongly urge that I'm glad that you're here and finding out this information, especially if you're a caregiver for someone who is already on Medicare. But if you yourself are thinking about Medicare, keep talking to us, keep connecting with your local Shine program, or if you're in another state too, with your local SHIP, because the more you know, I think it's great. But make sure that before you are actually enrolling, that you are getting the most up-to-date information.
Thank you, Kathleen. So the next question was about Part D. So if you're on a Part D plan that is not paid out directly from Social Security, is there a way to make it so that it is?
I think I might have missed the middle part. Was there a way to get it to
paid out directly from Social Security? And then
yeah,
just why some plans do it that way and others don't.
Yeah, so when you actually enroll in a Part D plan, you can't opt to have it come directly out of your Social Security check. Some people like that. But I will caution you that if you need to change plans often, sometimes there may be a lag in time. So just be cautious of that. But you could also connect with the plan that you're enrolling with on whether or not they have like an automatic payment to come out, because it might be a little easier to manage connecting with them and stopping your payment, or starting to have like an auto draft.
Great, thank you. And the person that asked that question, if you have follow-up questions, feel free to put that in the chat or the Q&A. So the last one, I think, unless we have any others, is how can family caregivers navigate the process of enrolling their loved ones? Can Shine counselors work directly with family caregivers? Are there things that family caregivers can't do that their loved one would have to engage in as part of the process?
No, I think it's great. Sometimes we work directly. We work directly with the caregiver. Sometimes before we even connect with the beneficiary. So we're able to review all of this information, review their current situation that they may be in. And, when it comes to reviewing like some of the mass health programs or some of those additional things that are maybe from an ASAP and some of those additional resources like home care or Meals on Wheels, things like that, we can connect you directly with the ASAP as well, or a council on aging. But when it comes to like the Medicare aspect and applications, things like that, we are able to really walk you through all of that information.
That's great. Thanks, Kathleen. I think that's it in terms of the questions we've gotten so far. So thank you for walking us through, and for everyone. Kathleen is sick today and she still made it on and gave a fantastic presentation. So thank you, Kathleen. And thank you all for joining. We had great turnout today, really thoughtful questions. Please join us on March 28th for the second part of the webinar series, this two-part series. I put the link in the chat. It'll also be on the webinar series landing page that I had put in the chat earlier. And if you have other questions, you have topics that you'd like Kathleen to cover at the next meeting or the next webinar, or for future webinar besides focused on health insurance, please put that either in the post-webinar survey or email us directly at caregiver@mass.gov. Thank you so much for joining us. We'll see you at the end of March.
Thank you.